So I'm here with spinal neurosurgeon Mr. Dan Plev at his Harley Street consulting rooms in London. Dan, we're having a chat about spinal surgery and just want to look at sciatica. Can you tell us when patients or when you become interested in sciatica, when might somebody need to consider the opinion of a surgeon for sciatica?
Well, I could say I'm always interested in sciatica, but the patients who come and see me with this condition, which is quite descriptive, meaning pain down the leg, is caused by a issue in the lower back, which comes from a disc pressing on the nerve, which swells up and then ends up being painful and presenting with a specific pain down the leg. And patients coming to see me is either because the pain is intolerable, not responding to the normal over-the-counter analgesic medication, or indeed because they start experiencing weakness or changes of sensation, which is loss of feeling or altered feeling.
Do most people who have sciatica, do they try conservative treatments first, and does a lot of that sciatic pain go away? Why does it go away?
Definitely. The first port of call is conservative treatment, oral analgesia, muscle relaxants, anti-inflammatories, which nowadays you can get over the counter. Obviously, it makes more sense to have somebody keeping an eye what you're taking to make sure that you're taking the right doses. But the pain will improve on the basis that our bodies do have the ability to heal themselves. And it improves because the bulging disc might retract, might shrink, so there will be less pressure on the specific nerve, which means less pain and obviously also less neurological deficits.
Okay, so if the conservative treatments are not working, and people have unbearable pain, and then I think you described sort of weakness, then that's when they might be considering a surgeon. What sort of weakness would people be experiencing that would lead them to want to get a surgical opinion?
So before going to the surgical options, it might be worthwhile to try an injectional treatment, just because you apply and you drop some very specific slow release medication in the form of cortisone, taking the swelling in this area and addressing the pain and also addressing the nerve function. Though patients where the weakness is progressive, so it's getting worse, weakness affecting different muscle groups depending on which level in the back is affected. You can have weakness going up and down the stairs, you use the banister more, and that's
the weakness in the leg.
In the leg,
right.
Weakness in the leg.
Yeah.
You have weakness in your foot.
Okay.
As in a drop foot, which means it's very specific for a specific level, or you have weakness when trying to dance ballet. I'm not sure how many people do that, but that would be tiptoeing, which with calf muscle is affected. Patients do recognize this and should be concerned if it's getting worse. Should be concerned if it's not getting better. And then should definitely have an MRI scan and an opinion from someone who will be able to point them in the right direction.
Okay. Thanks, Dan. That's great. Thank you.
Pleasure.